Hi, my name is Megan Lever. I am the co-founder of the Patient Experience platform, and I'm here to speak to you today about what patients think. So looking at the trends and variation in patient experience across hospitals in England between 2019 and 2020. We are nominated in the category Using Insight for Improvement, subcategory Innovation. So we've had a great year. We are sponsored by Innovate UK. We were chosen by DIT's Department of International Trade as one of the first 100 UK digital health companies. We're an HTN award winner for Best Patient Experience Technology, and we are part of the NHS Innovation Accelerator. Also, one of the highlights of this year was when we were chosen to showcase our work at the G7 in Cornwall. So who are we? We are a UK-Dutch SME founded by two healthcare leaders. It's myself, I'm a psychologist by background, and our other co-founder, Alex, who does a lot of the data science wizardry, who envisages a better, faster way of listening to patients. So we've developed a unique IP and AI technology that generates practical real-time insights about what patients really think about their care. We are also the only empirically proven specialized healthcare social listening tool developed globally. We believe this real-time feedback on all providers creates an unbiased pictures of trends and variations, strengths and weaknesses across the system, and can help improve the patient and customer satisfaction to improve acquisition and retention. Patient feedback is recognized as critical to the measurement of safe, effective, and good quality care. And since the Lord Darcy review in 2008, the NHS recognizes that from the perspective of a patient, high quality care has three distinct dimensions: experience, effectiveness, and safety. Collecting and understanding patient feedback is hard. PEP Health has developed the tools to help. There's a huge amount of real-time, publicly available patient feedback being posted online, and PEP Health has developed the patient experience platform to agnostically access these insights and comments and traditional methods. Over 10 million data points are collected that directly relate to patient experience of care each year in England alone. These are from sources such as traditional sources, FFT, CPES, and PES surveys, as well as untraditional sources such as Google reviews, Twitter, Facebook, and other future sources that are used to specify specific disease conditions like cancer forums. We then ingest all of this data and we run through our algorithms. So our algorithms first identify whether or not the comment is relevant to the quality of care. It then tags it to geography and location, and then themes it by 8 internationally recognized principles of care. The scores are an effective predictor of outcomes of in-depth quality inspections of hospitals and support quality improvement. This real-time data is available to hospitals through our dashboards and APIs, as well as this What Patients Think report that I'll cover today. Patient feedback is categorized and scored by department and across 8 internationally recognized quality domains. These are fast access, emotional support, continuity of care, involvement of support of family and carers, clear information, communication and support, involvement in decisions and preferences, appropriate environment, and effective care. Here you can see some examples of comments that have been left that have been tagged to each of these domains. The What Patients Think report has provided the first national overview of patient experience. After analyzing this data, we published the report, which first provided the comprehensive insight into patient experience across each NHS trust in England. There were 6 key findings from our What Patients Think report. The first was that their overall is considerably more positive than negative feedback from patients and the care they received from providers over that year. The second finding is that variation in patient experience is seen at all levels, regionally, between STPs or ICSs, and from one trust to another, as well as even within departments of the same hospital. The third finding is that nationally there is a decrease in patient satisfaction across most quality domains throughout autumn and into early 2020. And I can say that we have seen that trend continue through 2021. Reported experiences of acute care improved distinctly as the COVID-19 pandemic took hold. However, there are key indications of a plateau and decline in patient experience from late summer to early autumn 2020. And despite showing one of the widest variations in patient experience, maternity services still saw a national rise in performance from March through May 2020. Our report identified significant national variation in patient experience, and that the impact of COVID and the national lockdown restrictions have created significant variation in national patient experience, as seen through regional comparisons, like the chart you see on the right-hand side. The variation has continued to increase as the COVID pandemic has taken hold. This national picture is a powerful tool to identify stress across the system. For example, we see here that London has seen the largest swings in patient experience, as well as the steepest drops. Our report also identified significant national variation through the drilling down into individual quality domains. So here we get a flavor for why and what are the drivers for that decrease in patient experience. So, for example, we see here that it's fast access that has really made a difference in terms of driving down the patient experience across the regions. This view is also available at the inter-hospital and services level, providing managers with the granular information they need to fine-tune services. The patient experience scores in the report correlate to the CQC's overall experience score. So here on this graph, you see that each dot represents a trust. Their CQC inpatient overall experience score determines their position on the x-axis, and the y-axis position is their PEP Health overall experience score rating for the same time period. Here we have an example of the Royal Surrey Foundation Trust, who have pioneered a patient-led quality improvement through the use of our tool. They are one of the best performing trusts for a positive patient experience and an early adopter of the tool. They have said that the trust has used it to enable them to provide direct real-time connection between patient feedback and service delivery, provide meaningful feedback to the front line, and a proactive response to management of negative comments, as well as the divisional access to the dashboard for real-time feedbacks and trends. Hospitals have gained real value from the report and the patient experience platform. Some of the comments that we've heard are access to real-time insights and experience is important. It's a potential indicator to support culture for continuous quality improvement. It supports the allocation of resources, policy influencing, understanding communication to and from patients, provides a system-wide overview, and measures access to personalized, reliable medical information, as well as tracking the administrative process and understanding patient anxiety and the exacerbating factors around their experience, as well as identifying key delays and bottlenecks. So patient experience matters, and there's more work to be done. The patient experience platform and our What Patients Think report have highlighted important actionable insights into improving patient experience. However, our work is far from done. We plan to first publish the 2021 What Patients Think report, as I mentioned, in mid-October. We plan to continue to incorporate more sources of patient feedback onto our platform and work with integrated care systems and their primary care providers to understand patient experience at all levels of the system. For further information about what we do at PEP Health and how we might be able to help your trust, please do find out more by getting in touch. So email inquiries@pephealth.ai or visit our website to find out more. Thank you so much for taking the time to listen to my presentation today, and I look forward to hearing about all of the exciting innovations that have been nominated this year. Thank you so much.